All right, so we're expecting an update on measles cases. That'll happen tomorrow. But we know that some of you might have questions about testing, maybe about vaccines, because we are right in the middle of spring break. So right now, just so you know, to catch you up, Texas has more than 300 cases. There are at least 40 cases in New Mexico and in Oklahoma. They're reporting 4 probable cases. So we want to talk to an expert. We've got tonight with us Chief Medical Officer Dr. Jay Hurd. Thank you so much for being with us.
Thank you.
Baylor, Scott and White, All Saints Medical Center, just so you know. So we know that right now we don't have any cases here in our area, right? But traveling, that's what I mentioned at the top. Some folks might want to know about testing. Some folks might want to know, how long does it take? If I do want to get a test, how long do I have to wait for those results?
It's unfortunately quite a bit now. The PCR test, which is the test for the actual virus RNA, is 2 to 3 days and it has to be sent to the state. The test for the immunity, the IgG to rubeola, which is the virus that makes measles, can take 2 to 3 days also.
Okay, so we're talking about...
the best thing is to make sure you're vaccinated, check your records. If you've gotten your 2 shots, you should be good.
Okay.
Or get a booster. If you're unsure, you can get a booster. It's not that expensive, and that'll just boost your immunity.
Yeah, sure. Good advice for sure. What if people don't know where to start? Say I'm not vaccinated, or I don't know if I need a booster. Where do we start in terms of record gathering for that? Probably
your pediatrician, if they're still in practice, or still have records. Or maybe your primary care got them from your pediatrician a while back. But it really is safe, even if you're vaccinated 20, 30, or 50 years ago, to get a booster, because your immunity can wax and wane and go down. We're used to, as an OBGYN, we're used to checking people's rubella, which is German measles, to make sure you're immune when you get pregnant. Rubeola, it can be checked also. Can
you test for any antibodies against the measles?
Yes.
Okay.
Yeah. So the test for immunity is checking for the antibodies.
Okay.
The IgG antibodies.
Okay.
Against rubeola. Correct.
Okay. So that's what you asked for. Obviously, your recommendation is to be vaccinated. For folks who are not making that choice, what do you recommend to families who are and to those who aren't?
To those that are not, just be careful. If you're going to be traveling against somebody that you don't know their vaccination status, or if they have it, wear a mask.
Sure.
An N95 can help tremendously, but it's only 95% effective. That's why it's an N95. And just don't be in crowded rooms with people, especially if somebody's coughing. It's rubeola, measles is the most contagious virus out there. If the studies have looked at, like, if an infected person goes in, even before they have rashes, before anybody knows they have it, if they go into a room with unvaccinated children or adults, 90% of those in that room will get it.
Wow.
But they won't show any signs, prodromal signs, for 7 to 10 days.
Takes us back to
and then they can go and spread it after 4 or 5 days to others.
Yeah,
so
sure.
We're going to go way above 300. I think 300 plus were by Friday. They release the numbers every 2 days a week, and they predict this is going to be going on for months. Yeah, that's what some of the other experts we've spoken to say. It kind of takes us back to COVID days when we're talking about vaccinations and masks. You deal directly with pregnant women. Correct. What's your recommendation for folks that are expecting right now? Should they be getting vaccinated, or do they have to wait? So if they're already expecting, if they're pregnant, no on vaccination, because it's an attenuated or kind of weakened live virus vaccine, and it hadn't been studied in pregnant ladies, so they cannot get vaccinated during pregnancy. So if they don't know their vaccination status, just mask when they're out in public. Pre-pregnancy, preconceptional, it's good to get checked for rubella, and you can also do a rubeola too. Okay. And then you can get boosted before you get pregnant. Okay, good things to keep in mind. I mean, we are living in interesting times, to say the least. Unfortunately. Dr. Hurd, thank you so much for being with us. Just so you know, you can catch this discussion and all of our other Eye on Health segments right now on our CBS News Texas YouTube page. Doug, I'll send it back to you.